The data landscape is large and complex. We asked First Nations health leaders how they approach the work and utilize data in unique ways.
In one of my PhD courses, we were creating different measures and validating those measures. One of the ones that I have been really interested in developing is a First Nations measure that looks at poverty from a First Nations perspective. A lot of the traditional measures of poverty that we use in Canada, they don't really apply or work in a First Nations context. So wanted to come up with something that can be used for First Nations that maybe isn't deficit-based, that maybe looks at wealth as opposed to poverty. So I'm working on a measurement tool to assess household poverty that is grounded in a culturally relevant, holistic model of First Nations well-being with a First Nations definition of poverty or wealth. Now, looking at would this be more effective than standard poverty measures in First Nations? We hear a lot of criticism about some of the way Canada looks at poverty in First Nations, but this approach will be grounded in a strengths-based approach, and it will incorporate the unique ways of knowing and understanding health and poverty within First Nations communities.
So our organization developed a unique indicator to learn about population. And so that was very distinct to us moving towards a health priority plan. Where we were challenged was when we meet with the governments and their population is very much, 0 to 6, 6 to 12, 12 to, and we were like, that's so unfair to our people because it doesn't look at the person and all of the things that they're facing individually. And so we thought all right, how can we indigenize this? How can we make this just a way for people, whoever is interested, to learn about that age is not linear. So it's very much, we created this tool that shows, okay, this is the age that the governments or funders or whoever, whatever we're looking at, this is what they determined the age to be. But outside of that age, within that age, is this a reactive or a proactive situation? Is this a reaction to this pandemic we went through? Is this a reaction to maybe a child was taken from their family and they're not that same child they were yesterday? So in the center is the reactive and proactive, and then around is the age, and then around that are the social determinants of health. And then around that is the quadrants, the mental, physical, emotional, spiritual. And so what we do is we have this pointer thing. And so we're like, okay, this is a proactive moment. This child is maybe 7 years old. So then we'll turn that to 7, but they're facing loss of culture. So we'll turn it to that. And they're really struggling with their mental well-being. So then we'll turn it to that. And then you have this greater picture of an individual, which isn't just a 7-year-old child. It's a 7-year-old child who is, having challenges, maybe navigating their new situation that is struggling with mental health. These issues that are on this individual go beyond their bracketed age group services that are provided to them.
Well, it's important to understand that whoever you can have help you in accessing and collecting and analyzing data is important. We're fortunate here in the region of Quebec that we have the First Nations Health and Social Services Commission, who have a great team, research team that provides tremendous support in the data collection and in the tools to use, in the analysis and whatnot. So it really is a strong support for us. They're also able to collect data from the province. So we have means to measure and kind of quantify certain things and efforts and whatnot, because sometimes the provincial system will say, yes, everything is fine in our province, but they exclude our numbers as First Nations. So sometimes we need to remind them that we have data also, and they're not exactly how you've collected them. So using your tribal councils, using even National Statistics Canada, use all the data you can find. I mean, partners develop partnerships with them. So When somebody else is doing it, the wheel will continue, you will improve and whatnot. So it's important to have these external resources.
In a variety of ways. I think there are a lot of factors that determine how the data and indicators are used. Large communities and provinces have been able to come up with more modern ways of collecting data, while smaller communities still use the ways that we've always collected data. There's a knowing in the communities that's always been there, and it comes from people knowing their people. When we know something that is not working out, or if we think something will help, we do it. And we talk about it and we come up with different solutions to help support or fix things. We never wait to start.
In our community, we took advantage of the surveys that were already made available to us, the regional longitudinal health surveys, economic and education surveys, all kinds of things that were already established from either a national organization, AFN, our regional organizations, and our tribal councils and whatnot. The challenges we had is, okay, who are we going to get to conduct these things? Because bringing in strangers was not the answers, but we needed to find local people that people could trust, that our members could trust. So it was important for us to identify those folks and, kind of lead them into, to understand the importance of what we're doing, and also give them training to support them. So one of the key things was finding good people to do these researches and collect data.
For any research taking place in their community, it's important to ensure that all data-related activities adhere to ethical standards, and it's prioritizing the well-being and the autonomy of the community and the community members. Important to implement clear ethical guidelines for data collection, storage, and use within the community. First Nations can also engage in collaborative partnerships, fostering partnerships with external researchers, institutions, government agencies, or other Indigenous researchers to leverage resources and expertise. Making sure that you have really strong collaborative agreements in place that prioritize community interests, data ownership, and mutual respect. It's important for First Nations to define their research priorities, ensuring that they align with communities' needs, concerns, and also conduct regular consultations with community members to identify and prioritize their health research topics. And sometimes what the community wants might be different from what leadership wants, but it's important to make sure that you engage with your members.